Good afternoon, everyone, and thank you for joining today's webinar. Today, we will be going through webinar 3, which is Your Metagenomics Questions Answered. For those of you who have not met me yet, my name is Bianca Maree Harrington. I am an accredited practicing dietitian and also the lead microbiome coach for Microba. I am also joined by my colleague Christine Stewart, who you will hear from shortly. Christine is a registered nurse and nutritionist, the secretary for Nutrition Australia, and also a fellow microbiome coach here at Microba. Firstly, a huge thank you to all of you who sent through your questions in preparation for today's webinar. We were definitely overwhelmed by the response and hope to cater to most of those questions today. We have grouped together the questions into certain themes that we are going to address. There were some additional questions that unfortunately we weren't able to factor into today's webinar due to time constraints. However, we will be endeavouring to answer these questions either directly via email, and we do also have it on the agenda that we will be providing additional content in the forms of these webinars next year. So the main categories that we are going to be going through today in the webinar is a deep dive into the healthy group comparison cohort. This is a really valuable area to understand as a practitioner, as this is essentially how Microba report on their data. We compare your patient's results directly to the healthy group controls. So Christine will be taking you through that to give you a really clear idea around the exclusion criteria. We will be looking at the potential for application of metagenomics in nutrition population-based epidemiology and intervention, as well as looking at the suitability of Microba Insight with upper gastric conditions such as SIBO and reflux, as well as the impact that reflux medications have on the gut microbiome. We have 2 case studies to present to you today, which will look at both compositional and functional changes with customers who have used Microba Insight directly, as well as highlighting the clinical relevance of this and how you can continue to use this type of testing in your practice. So without further ado, I'm going to hand you over to Christine, who is going to start off today's webinar by taking you through the healthy group controls.
Thanks, Bianca. So we did have several questions asking about the criteria of our healthy group. And as Bianca sort of touched on, it is really important for you as practitioners to, I guess, understand more about how your clients' results are being compared. So our test does use a group of healthy adults, and we use data gathered from some of these 5 questionnaires that you can see highlighted to the side here. So these questionnaires are all voluntary in nature as well. So our customers are welcome to answer some questions or omit them if they'd like as well. So the first requirement is that they have to be at least 18 years of age or older. And this means that we don't actually have a comparison group for children or adolescents. So bear that in mind if you're ever wanting to test the microbiome of people under the age of 18. But we do want to implement that in the future. That's something that we probably will look at down the track. We also require that the adults in this group have not had antibiotics, antifungals, or immunosuppressants in the last 6 months, and that's because these types of medications can actually affect some of the beneficial bacteria as well as sort of doing their job of what they're designed to do. So we do allow 6 months between some of those medications to allow for someone's usual microbial community to reflourish, things like that. We also exclude people that are on medications that strongly influence the microbiome, and there's some examples there. So one of them is proton pump inhibitors, which Bianca will touch on a little bit more in this webinar. Some of the other exclusion criteria include people who have a BMI over 30, those who smoke and who are pregnant. We also use the Depression, Anxiety, Stress Scale, DAS, in our mental health questionnaire. So anyone who actually scores a moderate or above is actually also excluded from the healthy group. People who don't consume fruits and vegetables every day are also excluded, and also people who don't have, or people who have more than 2 alcoholic drinks per day. So on this slide, we're actually pointing out a little bit deeper into some of the major medical conditions that people can be excluded for as well. So people who are reporting any conditions that fall underneath some of these major bodily systems won't be included. So there were actually several conditions under each of these categories, and there was actually far too many to list out. So if you actually were interested in some of the finer conditions or the details under these categories, please feel free to contact us and we'd be happy to go through this in greater detail with you. And the last criteria here for the healthy group was that they shouldn't have any reported infectious diseases. So one of the other questions that we had submitted was about the potential for application for metagenomics to be used in nutritional epidemiology. Now, this is actually one of the questions that excited me the most because I do actually have an interest in this space. So, just quickly, nutritional epidemiology is actually the study of health and disease in humans. So I guess quickly my short answer is that yes, I do think there is actually a great potential for metagenomics to be used in the public health nutrition space. And the main reason for this is that there are so many studies already published and many, many more currently underway that are investigating the role of the gut microbiome in various health conditions in humans. So we find here at Microba that there's actually papers published all the time, almost one every day on this topic. So because there is such a great interest in the gut microbiome, I see that one day we'll end up with a very large volume of evidence, which is what's needed to help inform policy and also position statements for health promoting agencies and things like that. So how fast this comes around is a bit hard to say, but it's moving at a very rapid pace. Plus, as the sequencing costs for metagenomics come down, it'll become more accessible over time as well. So that's exciting. So even though Microba haven't published any papers at this level just yet, we do have this scale of data in mind, and I thought I might run you through a little bit of how we might be able to fit that question. So firstly, measuring diet in free living populations is somewhat of a challenge, as individuals' diets can be often complex and influenced by various factors, as I'm sure you're all aware. A common method for collecting data in large-scale observational studies is the use of a food frequency questionnaire due to its ease of use, ability to capture long-term dietary intakes, and also being a low burden for participants. Another common method is using multiple 24-hour recalls, usually about 2 to 3 on non-consecutive days, as was used in the Australian Health Survey. So Microba have actually developed their own food frequency, and we're actually in the process of validating this at the moment. So the criteria for the food that we want to capture is foods that are commonly consumed in Australia, foods also known to have significant interaction with the gut microbiome, and also we wanted to allow consistency with the Australian Health Survey data. So all of these data is actually quite useful for nutritional epidemiologists. So Microba do use the Australian Dietary Guidelines as our reference point for comparison as well. And at the moment, this is used to compare individuals' results against. However, there's also potential for an analysis to occur at the population-based level, so long as we had a representative sample for this analysis. All right, so this is actually showing some additional demographic data that Microba are actually able to capture through some of those questionnaires we mentioned earlier. So you see, we actually can gauge people's age. We ask them to report on their ethnicity, their relationship status, some household dynamics, and also their education levels. And we do get people to self-report on their anthropometrics like height and weight. So there is a potential for researchers to actually add some additional information if that's what they were looking at, depending on their type of research. So we can factor this into the overall analysis as well. So that's about it from me from now. So I'll hand over to Bianca and she'll run you through some of her questions.
Thanks, Christine. So I'm going to switch gears now and have a look at the suitability of Microba Insight with SIBO and reflux. So some of those more common upper gastric complaints and conditions that your patient may present to you at your clinic. Firstly, I just wanted to quickly jump to this slide just to show how the microbiome is likely to change throughout the intestinal tract. So given that there is quite a change to things like the pH, as well as other proteins and all sorts of things that occur throughout the intestinal tract, as well as the fuel sources that are readily available. This also means that the composition of the bacteria and their genetic potential do change. And what we really wanted to highlight is that Microba Insight is specific for the distal end of the gut. And currently there really is insufficient research at this point in time to adequately quantify how changes to the distal gut microbiome impact the proximal gut microbiomes and vice versa. So our position is that we do encourage that alternative testing is used if these medical conditions are suspected. However, there may be potential for improved patient outcomes if choosing to simultaneously test the gut microbiome in conjunction with these other tests. Now, just I guess like a little side topic to this, specifically when we look at common reflux medications like proton pump inhibitors and the gut microbiome, what we generally see from the research and also from the results that we do see from our cohort here at Microba, so the customers who have used the Microba Insight test, is overall there appears to be a reduced diversity of the gut bacteria. And there also appears to be a lower abundance of common lower gut commensal bacteria. You also see a concurrent increase in oral and upper gut commensal bacteria, even when there is still a reduced diversity. So we're looking at bacteria that come from the genus Streptococcus, Peptostreptococcus, and even Porphyromonas. And these effects are also observed when we even factor in for other covariates. So some of the other covariates are things like age, fruit and vegetable consumption, high alcohol intake. You can even see changes in ethnicity or when they're factored for ethnicity. When you look at history with dieting, lower meat consumption, BMI, as well as the frailty index. And overall, there does appear to be a bit more of a variance between the diversities of people who are users of proton pump inhibitor medications compared to the diversity of users who do not use reflux medications. And if we have a look at results directly from Microba Insight users who have been on proton pump inhibitors for various amounts of times, you can see this in the microbiome profile section when you change the filters specifically to look at the table view. And so we can definitely see here that there seems to be this dominance and really high levels compared to the healthy group controls of some of those common oral microbes like Streptococcus salivarius and Streptococcus angiosus. This particular case here was a lady, a female who had been on proton pump inhibitors for nearly 20 years. And Streptococcus salivarius had actually formed one of her most prevalent and abundant bacteria in her microbiome at around 7%. So it's nearly borderline that dominance that we would indicate whenever a patient has really elevated levels of species in their gut microbiome. And just a quick question that we wanted to touch on is this is something that we do get asked quite a lot regarding Microba Insight and the potential for either Medicare or other health rebates. Currently, we are not covered by private health insurance or Medicare. We are undergoing accreditation assessment, however, for ISO 15189, which is through NATA or the National Association of Testing Authorities. We are required to meet both ISO and the NPAAC or the National Pathology Association Advisory Council requirements in order to be conferred accreditation. We are hopeful that once this accreditation status has been conferred, that there will be potential for your patients to receive rebates with private health insurance and Medicare rebates. Unfortunately, we can't give a time frame for when this is likely to be, but it is definitely something that we see for our future. Now, looking more specifically at the relevance of Microba Insight in clinical practice. So it is definitely important to understand the species that are present in the gut microbiome. However, what we're starting to see is that there are actually quite a variety of bacteria that could be detected in the microbiome. So it is estimated that we only know approximately 30% of the current species, and we are discovering new species all of the time. Microba alone, in the 18 months that we have been in operation, have discovered over 600 species of bacteria. And what's really interesting about this is that some of these species that are newly discovered have similar functional functional potentials as the bacteria that have been well classified by science. The other benefit, or what is also good for you to know as a practitioner, is that the functional capacity of the microbiome is generally more clinically relevant and modifiable. In fact, there is a significant body of research which conveys the understanding on how you can actually improve your patient's functional capacity or their metabolites of the bacteria in their sample through dietary modification. And that's why a significant outcome from our report is looking at dietary suggestions that are going to help with assisting in improving that functional potential overall. The metabolites produced by the gut bacteria interact with our physiology directly, even if you use the examples of short-chain fatty acids. So there's something that are well researched by scientific circles. We have short-chain fatty acid receptors throughout our body, which is indicating that relationship that occurs between our gut microbiome, and then to assist with things like reducing inflammation, regulating blood sugar levels and appetite, etc. An example we can give you too on why focusing on metabolites is more beneficial than just focusing on species alone. There is a really well classified species of bacteria known as Faecalibacterium prausnitzii. This species is a well classified butyrate producing bacteria. There have been many a time where we have seen Microba Insight customers who have undetected levels of this species, yet their results either indicate that they still have adequate butyrate potential when compared against the healthy group, and sometimes they still have an even high potential compared to the healthy group, even in the absence of having this bacteria. Something that we wanted to show you as well, so for those of you who are currently registered as one of our Microba informed practitioners, is that Ken and Hayley, so Ken is our technology liaison manager and Hayley is our clinical applications specialist. They have gone ahead and created some incredible resources that are located in your Microba informed practitioner portal. So if you would like to head to this portal, then just head to healthcare.microba.com and use your user credentials to log in. Inside the clinical resources page, you will find some great resources that we have created. And as I mentioned, Ken and Hayley have definitely pioneered a lot of this space. Specifically, the clinical reference guide is something that's going to be really handy for you to use in practice. So even just giving some examples to you here, if we focus on high human DNA, so away from diet for a moment and looking at what is recommended, if your patient is indicated to have higher than 4% of human DNA detected in their sample, so we would be recommending that they go on for further GI conditions and exploration. So perhaps they're not up to date with their scopes, maybe they need to be referred on, or maybe they might be indicating that they have some inflammation going on, perhaps from some food intolerances, if they are someone who's presenting to you with, say, IBS-like symptoms. So that could be one action that you can take. If we look at IPA, so IPA is a strong antioxidant that's produced by our gut microbiome that helps to prevent our nerve cells from oxidation damage or assists in managing that oxidation. So if your patient specifically has low levels of this, this is not ideal. Ideally, we want to be increasing the total consumption of prebiotic fibers. However, particular emphasis is displayed on whole grain rye as being the prebiotic that increases this IPA production. If we look at something like trimethylamine, so trimethylamine production is associated with chronic heart disease as well as chronic kidney disease. And ideally, we want to be reducing the production of this. So specifically, there is choline and carnitine more so in foods that you would find in things like red meat and eggs. It would be a good opportune moment to perhaps look at reviewing how much red meat and eggs your patient is consuming. But there has also been some further research which has actually looked at cruciferous vegetables being able to assist in reducing the production of this through DIM. So DIM just helps to inhibit this production, and you can find the DIM in foods like broccoli, kale, cabbage, cauliflower, Brussels sprouts, etc. So you could emphasize those foods specifically more so. And then finally, beta-glucuronidase potential is another good one to address. So beta-glucuronidase essentially refers to the activity of some bacteria in the gut that have the ability to reactivate certain substances in the gut microbiome once they have been deactivated, which means that essentially their potency can increase in the blood, which can make some people quite symptomatic, especially when we're thinking about side effects from major hormonal changes. So people who might have estrogen dominance, or perhaps people who have some pretty nasty side effects to regular medications. So you definitely can get beta-glucuronidase in supplemental form. However, there are specific foods such as broccoli and apple, which can help you to increase natural forms of calcium D-glucarate in their diet to help with reducing some of those side effects. So I will take you now back to Christine, who I believe is going to take you through our first case study for today.
Thanks, Bianca. So we did have an overwhelming response as well, requesting for case studies. So I'll just pull up my case study now for you. Here we go. So I went for quite a really nice, easy one that shows how the benefits of increased fibre really can help in terms of what we're looking at in the Insights report. So this was one of our customers who originally just did their Microbe Insights test out of curiosity, not reporting any major gastro symptoms or anything like that, no major medical conditions. So we can see here that his diversity is actually on the lower end of average. It's not super low, but it's sort of creeping up that way. And you can see here that he actually has a high proportion of those protein degrading species as well. Then if we go have a look into dig deeper into the detail, one of my favorite aspects of this part is actually looking at the profile tab, because this is a really great way to look at diversity. Because that green bar graph on the front overview measures the number of species and also the evenness between the species, this is a really great way to visualize that. So you can see that he has actually a fairly good number, so I would say an average number of species, but there is some that are a little bit higher in their dominance, and you can tell that by the size of the circle. So that's the bubble plot that shows a diversity in a different way. Then we also have a look at his important species. So this section is looking at species that have been important in terms of science so far. So it's not an important list of species that you must have detected, because no such list even exists. But these are species that we know a little bit more about. We know what they do, we know what they consume, and some of their functions that they do perform. So for this person, there was actually 4 species that were able on this list that were detected. There was no pathogens here, and actually they're fairly beneficial species and all in fairly good abundances. Then we have a look at sample composition. This is one thing that you'll be looking at as a practitioner. So we do look at the amount of bacteria that we're able to read and have report on, as well as the novel species, but we also look at the human DNA. So Bianca mentioned this a little bit earlier in the clinical reference guide. So anything above 4% we would recommend having investigated further, so long as they are quite confident that they hadn't touched the swab. But you can see that this person actually had about 2.28% compared to what we see in our comparison group. So we do allow for a small amount to be detected because of the natural shedding of intestinal cells, but this is something that you probably would watch in later reports to see if that has changed, and hopefully it's on the lower end and reducing down and not sort of creeping up. But that's one thing that you would be watching as a practitioner as well. Then I'll touch quickly on the dietary data. So for this person, his fibre intake, I'll just quickly refresh that. Hopefully it will bring it up for us. Here we go.
That's okay. I think it's in here, so that's all right. Technical difficulties, you can
Yes.
never control them, unfortunately.
Yeah, so if you zoom in a little bit, so his fibre, thanks Bianca, so his fibre was sitting at about 25 grams or so. So it's actually below what's recommended. So we use the suggested dietary target of 38 grams. So this is actually a male, and his was sitting at about 25 grams. So what he went away and did is he actually decided that he was going to increase his fibre consumption and wanted to retest the impact of what that would look like. So based on his food frequency data that he submitted, his major changes were he actually increased his porridge consumption, and it went from about 3 times a month to daily. So he increased his oats. He also changed his bread from white bread to rye bread, which was really encouraging to see, which was lovely. He increased his consumption of fruit from 1 serve per day, roughly, to about 4 serves per day. So this is probably a bit higher than what we would usually recommend, but we did bear in mind that this actually was reported in February. So he actually had increased his fruit consumption over summer. And he did actually select more fruits, so such as nectarines, peaches, plums, and mango. So they were the major changes, and obviously they are summer fruits. So it's something that you would, I guess, consider to be quite common for people to have a bit more fruit in those warmer months. He also increased his consumption of nuts. So he wasn't actually consuming any before, and then he has increased this to having them about 5 to 6 times per week. He also wasn't having any pulses or dried beans, and he did increase this to about 3 times per month, so almost weekly as well. So that was a really great changes in his diet. So let's see what that impact had. So you can see this was his original diversity level, which is coming up at that lower end of average. And in only 4 months, which is actually a fairly short amount of time for some dietary changes to occur, he's actually increased it all the way up here to the average range, which is a really great outcome. So most of our customers do tend to bob around this midpoint, but having that increase has been really wonderful. He also had some changes in that bubble plot. So you can see this was his original one. He still has a more dominant species, but you can see that there's actually more species that have actually popped up. So we have a larger amount of the firmicutes and also some of, I've forgotten the name of these ones.
Actinomyces.
Thank you. Then we have a look at his human DNA, which is really excellent to see that it actually has come down to almost nothing in his secondary report or secondary tests. So that's great. So he's obviously had some big changes there. So his human DNA is coming down, which is something that you'd like to see and monitor as a practitioner as well. One of the exciting things that we saw was that he originally had 4 of these important species detected, but in his second test, there was many more detected, so including things like some bifidobacterium species and some other beneficial species down here like roseburia. So this is really exciting to see. So he actually had an increase in these, so it sort of gives us the idea that he was actually nourishing and helping to encourage the growth of these beneficial bacteria, which is excellent. Now I'll pass you over to Bianca, and she'll run you through her case study.
Thanks, Christine. So yeah, as Christine mentioned, I'm going to take you through case study number 2. So this is an emphasis more on the functional changes. So looking at how the metabolic potential shifted with this case study from her first kit to her second kit. So this is based according to a 41-year-old female who approached Microba in June 2018 to complete the kit. So just a little bit of background about this particular customer. She was slightly overweight, so BMI of 29.4. There were some mild to moderate concerns around depression, anxiety, and stress. And she ideally wanted to look into the gut microbiome just to get an idea about how her microbiome is looking, but also how she can improve her overall health and well-being. Between the 2 kits, so January 2019, so 6 months went past, we saw around about 0.7 decrease in her BMI. So it was about 3 kilos for her height and weight. We also saw an improvement to her concerns around depression, anxiety, and stress, which is an excellent win. And factors like physical activity remained consistent between the 2 tests. So why we're pointing this out is it's good to identify any potential co-founders or covariates that might impact some of these results. So exercise remained consistent between these 2 tests. So let's have a look at the dietary shift. So it was approximately a 7-gram jump in fibre from her first kit to her second kit. There was also a compositional change in the types of prebiotics that she was consuming. So breaking these down into our core food groups, there was around about almost a total increase of 1 serve of grains per day. As you can see, there was a significant increase, so nearly 2 serves, or increasing by about a cup of vegetables per day between the 2 kits. A slight decrease in fruit, although she was only consuming around about 1.5 serves per day to begin with, so it went down to approximately 1. There was a slight reduction in her dairy consumption. And there was also an increase in her other protein sources. So this is specific for things like legumes, nuts, and beans, and not inclusive of proteins like red meat or poultry or fish. If we have a quick look at the changes to her microbiome profile, so looking at June 2018, we can see her diversity, or her Shannon index, was 3.36. Generally, anything around 3.5 to 4.5 is considered to be an ideal or optimal result, similar to our healthy group controls. If we have a look, there is definitely some dominance that is occurring in the Bacteroidetes phylum. So that particular species was Prevotella copri. As mentioned earlier, we tend to indicate dominance, usually above 10%, although arguably sometimes we can suggest anything above 5 might indicate that there is a bit of dominance that's occurring, and usually it's because of dietary preference of that particular person or lack of certain prebiotic fibers by that same person. There was also quite a significant amount of proteobacteria. So this was E. coli, and it was around about 4.4%. So potentially at a level where someone might start presenting as symptomatic, especially if it is the pathogenic type of E. coli that produces the toxin. Let's fast forward to January 2019. So as we can see, there was an improvement to her diversity. What has more so happened? So you can see there's an increase in her actinobacteria, but there's also been a subsequent decline in her proteobacteria, as well as her most dominant species, which was Prevotella. So we're seeing, as Christine mentioned before, it's nourishing of those native bacteria that are already living in the gut microbiome, and seeing an evening out of some of those other species that were forming, quite a dominant species in the gut. So let's have a look at the functional changes. So just to explain, obviously the first graph indicates the first test versus the second graph is the second test. This green bar here is what is considered to be usual for the healthy group control. So you can see how she compares not only between tests, but how her results have improved in relation to the healthy group controls. So hydrogen sulfide, H2S, is the gas that can be produced that can cause bloating, and sometimes that odorous flatulence. We saw a significant reduction in the potential for that. It was still a little bit higher than the healthy group controls, but it's been quite a significant decrease from kit 1 to kit 2. If we have a look at her IPA production, so beforehand it was virtually non-existent, and it's now reached a point where it's considered to be within that healthy group range. Even though it is on the lower end, it's still meeting that lower end requirement. We saw a significant decrease in her TMA potential, and a lot of that had to do with the E. coli species, as it's one of the main producers of trimethylamine in the gut microbiome. But as you can see, it went from being exceedingly high right down to being at a level within a level that's considered to be usual or common for our healthy group controls. We also looked at lipopolysaccharide, and again, we can see this significant reduction within the healthy group range, and also a reduction just generally from kit 1 to kit 2. And finally, her branched chain amino acid potential went from being higher than the healthy group controls to being within the healthy group range. So some significant improvements in just a 6-month period by making some minor dietary changes with those particular customers, and those recommendations were based directly from the microbiome coach appointments. So in summary, just to recap on the key points from today's webinar, there is potential for application of metagenomics in nutrition population-based epidemiology and intervention. And as Christine alluded to before, Microba are currently going through validation for our food frequency questionnaire as well, which is going to be something that can be quite helpful for future when people are looking to embark on research projects in conjunction with Microba. We do encourage focusing on a metabolic potential as it tends to be more clinically relevant as the metabolites are directly impacted by diet. It is still important to focus on species, but as we alluded to before, there are an abundance of bacteria that are yet to be discovered. So it is likely that the science is going to continue to trend more in focusing on function rather than individual species to get an idea about the health of someone's gut microbiome. We do also encourage that alternative testing is used if SIBO and or reflux are suspected for your patient, although there is potential for improved patient outcomes if you choose to simultaneously use Microba Insight in conjunction with other tests. So thank you very much for joining in today. We hope that you have found that helpful. And for those of you who have not yet registered for our free Microba Informed Practitioner program, the information on how to register is contained on this slide.